Doctors say some of the most common private habits men continue after 60 could be quietly damaging their blood flow, numbing their sensation, and slowly breaking down the very foundation of intimacy. And most never see it coming. You exercise. You eat right. You take care of yourself the best way you know how. But when it comes to intimacy, suddenly something feels off. Less responsive, less connected, less like you. Hi, I'm Dr. Mohit Khara, board-certified urologist and men's health expert for over 30 years. And here's what I can tell you with certainty. It's not just age, it's not weakness, it's not the end. It's often a pattern, a few simple but harmful habits that have built up silently over time. Habits that were never questioned, never taught, and never corrected. In this video, I'll show you the 4 most common self-pleasure mistakes men over 60 make, and how they quietly reduce circulation, dull your sensitivity, and affect not just your physical health but your ability to feel truly connected with yourself or your partner. But this isn't about shame. This is about awareness. Because once you know what's really going on, you can change it. And when you do, the results aren't just physical, they're emotional, they're intimate, they're personal. Let's take back what aging has tried to steal. One smart step at a time. Let's begin. Mistake. Number 1. Using excessive pressure. The death grip. What happens? Many men develop a habit over time, gripping too tightly during self-pleasure. It may start subconsciously, a way to increase sensation, speed things up, or compensate for reduced sensitivity. But after 60, this forceful habit can quietly become one of the most destructive behaviors to your sexual health. Here's what's happening inside. The penis is filled with delicate blood vessels, soft spongy tissue, and highly sensitive nerves. When you use excessive pressure, often called the death grip, you compress those vessels beyond what they were designed to handle. At first, it may feel effective. But over time, repeated pressure leads to micro tears in the vascular tissue, chronic inflammation in the erectile chambers, a gradual decline in nerve sensitivity, structural stress on the tunica albuginea, the sheath around the erectile chambers. These internal injuries don't hurt, which makes them dangerous. They accumulate slowly, quietly, until one day your body no longer responds the way it used to, and you can't explain why. Warning. Signs. You might be. Ignoring it takes longer to become aroused, even with strong mental or visual stimulation. Erections feel less full, softer, or fade quickly. You need to apply more pressure to feel the same amount of sensation. Sensitivity feels dull, inconsistent, or disconnected from emotional arousal. You rely on very specific motion or force to reach climax. These are early-stage symptoms of vascular fatigue and nerve dulling, and they are more common than most men realize. Risks. If ignored. Micro tears and inflammation. Repeated pressure causes tiny injuries in the vascular walls that never fully heal, especially with age-related decline in tissue recovery. Vascular hardening, arterial stiffening. Over time, scar-like changes develop in the blood vessels, reducing their ability to expand and deliver adequate blood, even when mentally aroused. Long-term nerve desensitization. Constant overstimulation dulls nerve endings. As they adapt to harsh pressure, they stop responding to gentler, natural forms of arousal, including with a partner. Erectile dysfunction resistant to medication. If the blood vessels and nerves are structurally compromised, even medications like Viagra or Cialis may not restore function. According to a 2020 review in the Journal of Sexual Medicine, force-based habits in older men are increasingly being recognized as contributors to erectile dysfunction, independent of cardiovascular health. A smarter, safer approach. This isn't about stopping pleasure. It's about retraining your body to feel more, with less force. Here's what works. Use a lighter grip and slow down. Gentle stimulation allows the blood vessels and nerves to operate naturally, which leads to better arousal, not worse. Focus on sensation, not performance. Let go of the need to finish fast or chase intensity. Aim for connection with your body, your breath, and your senses. Take breaks during stimulation, especially if you're noticing numbness or fatigue. Just 20 to 30 seconds of pause allows blood to return and sensitivity to reset. Rebuild sensitivity gradually. Many men report stronger, more pleasurable erections within 2 to 3 weeks of shifting their grip and slowing their pace. Use lubrication, covered in mistake number 2, to minimize friction, reduce inflammation, and support tissue health. Monitor your body's feedback. How do you feel 10 minutes afterward? 1 hour later? If you're more drained than satisfied, that's a sign your technique needs adjusting. A thought to reflect on. Your penis isn't a machine. It's living tissue. What worked in your 30s may now do more harm than good in your 60s and beyond. Treat this part of your body with the same care you give your heart, your joints, or your eyes. A gentler approach isn't weakness, it's wisdom. References: Journal of Sexual Medicine, 2020, Behavioral Factors in Erectile Dysfunction Among Older Men, Cleveland Clinic, Men's Health and Urology Education Series, UCLA Men's Clinic, on sensory nerve recovery and vascular care in aging males. Mistake: masturbating without lubrication. What happens? As men age, the skin of the penis becomes thinner, more fragile, and less naturally lubricated. This is due to a combination of lower testosterone levels, decreased collagen production, and reduced sebaceous oil gland activity. Yet many older men continue to stimulate themselves as they did in their youth, with dry hands and no lubrication. This dry friction might not cause immediate pain, but it creates microscopic tears in the skin. These are tiny but damaging injuries that weaken tissue integrity over time. And because the penis relies on fine capillaries and nerve endings for blood flow and sensation, even minor trauma, repeated often, can lead to long-term issues like scarring beneath the skin, loss of elasticity, dulled sensation, and impaired erectile response. It's not the occasional dry session that causes harm. It's the accumulation of small, repeated injuries over months and years that slowly alter tissue health. Warning signs you might be overlooking: a dry or tight sensation during stimulation, thinning of the skin, especially near the tip, less natural glide or flexibility during arousal, reduced fullness in erections, subtle burning or soreness afterward, gradual decline in touch sensitivity, even with arousal. Many men mistake these symptoms as just aging, but in reality, they're signs of tissue damage from friction. Health risks, if ignored: scar tissue formation. Chronic friction creates tiny wounds. As they heal, they form tough, fibrous tissue that lacks the elasticity of healthy skin. This can reduce expansion during erection and blunt sensation. Reduced capillary function. Repeated irritation thickens the connective tissue around blood vessels, reducing their ability to deliver oxygen-rich blood, a critical element in achieving and maintaining erection. Dry skin. Breakdown. With age, the skin loses its ability to self-lubricate. Dry stimulation increases the risk of small cracks, irritation, and local inflammation. Diminished pleasure response. The nerve endings that transmit pleasurable sensation may become less responsive due to chronic stress, leading to delayed or blunted orgasm. According to the Mayo Clinic and the Urology Health Foundation, dryness-related injury is one of the most underdiagnosed contributors to intimacy problems in older men. A healthier, more protective approach. Lubrication isn't just for comfort, it's essential maintenance for your most sensitive tissues. Here's how to protect your sexual health. Use a high-quality lubricant every time. Choose water-based or silicone-based lubricants that are pH-balanced and designed for sensitive skin. These reduce friction and allow smoother, more natural motion. Avoid products with alcohol, menthol, or added fragrances. These irritants can dry the skin, inflame tissue, and worsen nerve sensitivity over time. Apply generously. Don't be conservative. Reapply as needed. Friction is one of the few things where less is not more. Make it a habit. Keep lubricant within reach. Treat it like brushing your teeth or taking a daily supplement, not an optional accessory. Check your skin regularly. If you notice thinning, peeling, soreness, or color changes, stop and allow your skin time to recover before the next session. Think of lubricant as a preservative for your skin, blood flow, and pleasure. It's not about weakness or dependency. It's about staying functional, sensitive, and strong for the long run. Gentle reminder. You wouldn't rub your eyes with dry hands. You wouldn't shave without water. So why treat the most sensitive part of your body with less care? Self-pleasure after 60 should be gentle, nourishing, and sustainable, not rushed or rough. References: Mayo Clinic, Men's Sexual Health Over 60. Urology, Health Foundation, Tissue Health and Sensation Preservation in Aging Males. Journal of Urology, 2019. Chronic friction and capillary damage in non-intercourse male sexual activity. Mistake. 3. Sitting too long or poor posture during stimulation. What happens? Most men don't think twice about their posture during self-pleasure. After all, it's usually done in the same familiar position, sitting in a recliner, perched at the edge of the bed, or lying back with minimal movement. It feels convenient, comfortable, habitual. But here's what doctors and pelvic health specialists know that many men don't. Sitting for prolonged periods, especially in a hunched or compressed position, can quietly disrupt blood flow, irritate nerves, and damage the muscles that support erectile function, especially after age 60. The key area affected? The perineum, the sensitive region between your scrotum and anus. When you sit or curl forward, especially on a hard surface, you apply direct pressure to this zone. That pressure compresses the pudendal nerve, which supplies sensation to the penis, and it pinches the pelvic arteries that deliver blood to the prostate and erectile chambers. Over time, this chronic compression creates a traffic jam in your pelvic floor. Poor circulation, nerve fatigue, and reduced responsiveness, even when your heart and testosterone are functioning just fine. Warning signs that posture may be harming you. Weaker erections, even if arousal is strong. A feeling of numbness or tingling in the groin, thighs, or buttocks. Erections that fade quickly or feel disconnected. Delayed orgasm or a dull, muted sensation during climax. Mild discomfort in the lower back or perineal area after sitting. These aren't just signs of getting older. They may be signals of pelvic compression that's been building unnoticed for years. The risks. If this goes unaddressed. Chronic pelvic congestion. Just like sitting too long can cause swelling in your legs, staying in the same position during arousal compresses blood vessels in the pelvic basin, leading to inefficient circulation and a buildup of internal pressure. Pudendal nerve compression. The pudendal nerve, responsible for sensation in the penis and perineum, can become irritated or inflamed due to repeated sitting pressure. This can cause loss of sensation, reduced orgasm intensity, or even pain during stimulation. Pelvic floor dysfunction. Sitting for long periods without engaging the core or hips can weaken the supportive muscles of the pelvis, affecting bladder control, erection strength, and stamina. Erectile dysfunction. Not caused by hormones or heart health. Many men assume ED means low testosterone or heart problems. But in countless cases, the issue lies in the nerves and blood vessels being compressed during stimulation. According to the National Institute on Aging and experts like Dr. Irwin Goldstein, a leading authority in sexual medicine, posture is one of the most overlooked contributors to erectile decline in older men. Better, safer, and more effective posture. Choices. You don't need to overhaul your routine. Just make a few small, smart adjustments that support your anatomy rather than suppress it. Here's what you can do. Recline with lumbar support instead of sitting upright. This opens the hips and relieves pressure on the perineum. A small pillow behind the lower back helps maintain natural alignment. Avoid curling forward. This rounded posture compresses your abdominal cavity and places stress on the pelvic floor. Keep your spine gently elongated and your torso open. Use a soft surface. If sitting, place a folded towel or cushion beneath you to reduce direct pressure on the perineum. Place a pillow beneath your tailbone. This subtle lift can relieve compression and tilt the pelvis into a circulation-friendly angle. Shift positions every few minutes. Don't stay static. Light movement reactivates blood flow and reduces nerve fatigue. Consider standing or partially kneeling. If mobility allows, these positions eliminate pressure on the perineum entirely. Small positional shifts can have a big impact on your pelvic circulation, sexual function, and long-term intimacy health. Pro tip: incorporate hip stretches and pelvic mobility exercises into your weekly routine. Even 5 to 10 minutes of gentle stretching, like pelvic tilts, hip circles, or deep squats, can reduce muscle tension and restore flexibility to the pelvic floor. Remember, intimacy after 60 isn't just about hormones. It's about circulation, posture, and muscle support. Medical references: National Institute on Aging, The Role of Movement and Circulation in Male Sexual Health. Dr. Irwin Goldstein, Director of San Diego Sexual Medicine. Clinical Guidance on Pelvic Nerve Function and Posture, Journal of Urology, 2018. Impact of postural compression on erectile blood flow in men over 60.